children's emotional well-being, helping with families and children to establish very good, healthy emotional well-being. Always very much important during the pandemic and any disasters, any crisis, any trauma situation. So one of the things we commonly experience during the pandemic, and one of the things I believe we are not that successful right now, is we are not excellent providing a wonderful best support, best practices for children who really need emotional support, and who need more support to maintain well-being during the pandemic period. So as we all know, most of many every provincial, federal health systems and organizations, regionally, municipally, most of the organizations are trying to maintain the good support system. But unfortunately, what we're hearing from media, and what we finding from the statistics and research, children are not getting best support. Especially my experience last few months, I found many children experiencing several variable trauma recall, trauma issues, and previously unresolved trauma with anxieties and stresses. So it's becoming more and more growing. It's becoming more and more at this point. So I still believe we are not doing best as professionals, and also I still believe the parents are not doing their best. That doesn't mean that they're not doing anything. They're doing a lot, but I think they need to do more and more, because most of the children, all of the children, spending 2 to 3 years of their life, 1 to 3 years of their life with the pandemic. So that is highly affecting to their emotional well-being during the pandemic period. Released by the Center for Trauma Training and Trauma Research, University of Massachusetts, Harvard Medical School, Harvard University, SAMHA Treatment System, National Child and Traumatic Stress Network, and even Massachusetts University found still this need to be improved, and it needs to be still established family basis and community basis. So I think we need to more attention. So I would like to talk end of the lecture today amount of recommendation that we can easily try as a professional, stakeholders and family members and parents and loved ones, so that we can help with this emotional well-being, emotional support system. It is more than developing an emotional support network. I think we all need to establish domestic intensive network within the family members, so that would benefit in children's life. So previously today lecture we talks quite a bit about the biology, some of the neurobiology behind how the trauma is waking up, and what exactly happening with the trauma recall with children, and some of the information about how human nervous system, brain, neuropsychology, how impact on the trauma. But this part of the lecture I would like to focus the recommendation. So if you have any questions, you could write on the back, the left side, the question with a common email CC to all of you. So as we know, our family structure is now more organizing according to the pandemic. It's normal, it's neutral, and it's unavoidable. Approximately, it is almost 1 year right now, more than 1 year. We all are in a strong lockdown and social isolation period. But what we know, the trauma-related stress children experiencing, and the anxieties they're suffering, and what amount of depression signs they're showing up during school, and limited social background and families. So And also recently I found many children are getting to uh, substance abuse and substance misuse and several addictions. So addiction is becoming a very huge part of the children life now. So that's something I found, but unfortunately uh, um, the world used to service delivery aspect world used to be very one-on-one and human contact. So now everything is doing online. So people still have a little bit of taboo and issues about how the online can be support. um, but my experience, I found sometimes online services are more accurate and more effective than normal services, because uh, with boundaries and with certain level of maintenance, emotionally, behaviorally, and internally, subconsciously, people still can join with professionals and they can connect more than one-on-one. So there's both side of it. I'm not really here to justify what online the pros and cons is. But I think we could more focus with the recommendations that supported uh, protect the children emotional well-being during COVID-19 pandemic period. So there are 15-20 amount of recommendation. I like to basically go with a 10 amount simply that we all, and it's important to understand the reaction of the pandemic. Talking about the reaction of the pandemic reactions are very much different. Um, uh, it's different one on one. Sometimes it's very similar, and sometimes it is very different. So, for example, how children react to certain things much more different than adult. So children reacted to certain pandemic related trauma situation crisis is very different. If you ever talk to colleague of you, friend of you, family members, and an adult, basically you see how you feeling some cases very similar, but how children reacting to trauma, a crisis situation such as pandemic situations, very different. They respond to stress, how they respond to the stress event, stressful situations are different, unique, and very variable. So not, I mean, without having that mindful understand, again, it coming back to the mindfulness, the relationship mindfully you building between you and your children. If you don't have that mindful state between you and your children, you're not really mindfully understanding the stress responses are true or not. And some parents, my experience with the family settings, with parents in therapy, I found they struggle uh, exactly finding um, the responses, the stressful responses, how different. So they think they see everything from them, through them, so that they think what children are expressing is what they're expressing. So this is very difficult situation to handle. But having a lot of mindful work with children, engaging with children, especially trying to understand the challenging behaviors with how it naturally responses, and more empathically, more offering empathic, loving and kindness alliances and practices, you could understand much effectively the reaction to pandemic way. Every children deserve and needs to feel secure, loving, kind, safe, and positive about their present and future. Even though there is a risk, there is certain negative experience, but children have right and deserved to feel it securely. Parents' responsibility is helping children to feel the safe and secure, and not really bringing them and giving them so much um, affected scenarios. So we would talk about a little bit more how media and other electronic medias may be impacted on this. Um, Adult can help more children to focus their attention to narrative stories and scenarios about how people come together, how they work together, how they build up strength together, how they can find the creative solutions and creative activities within a household and society, and how they can get together and resolve the difficult problems and things they are dealing. So this is something that adult can more practice with children. It's very very important to establish that level. um, and also when children are feeling tired and bored, the level of worry and disruptive behaviors may increase. So you will see they are becoming more lazy and bored and worry, because children brain used to more busy than our brain. They like to do multiple things at once. They like to try. They're very workful, handful with the attitudely. Um, when children experiencing a laziness and bored feeling again and again, you will notice many disruptive behaviors are already building, developing on their insightful mind, especially with the subconscious. Um, the safe activities providing is more important. Like for example, some play therapy activities, outside play, sand work, sand castle building, sand tray works, a block modeling, building a clay, and getting together as a family and doing art together, and some games with proper social distancing. So this kind of activities always increase and establish a very strong level of resiliency and skill to deal with disruptive behaviors. Um, Social distancing, something we always discussing, we always talking about. Uh, Children have a lot of children. My experience with within the therapy room, within clinical settings and social settings, I found children misunderstand social distancing and social isolation. So children think social isolation is social distancing. As a parents, service providers, and adult caregivers, it's important to help them to establish an idea. The social distancing is not social isolation. So by practicing right social distancing and social isolations with social connections, improving and showing the resiliency with the healthy diversity, you could always help them to understand the difference between isolation and distancing. Because don't forget, children build up isolation due to distancing. This isolation might change their neuro system, their brain system of personality. Children develop with a negative personality within these 2-3 years that might stay with them forever, because they are living their childhood. So it's very important, this point. Um, so again, if you have any question, I see few of them already typing questions. So end of the lecture, I would discuss these questions. We have 6 questions right now, 7 questions. So keep writing your question. We would spend 10 minutes to 15 minutes. We'll discuss about this neurobiological and some other questions. So responses to stressful event, unique. It's different, right? We discuss about this, and this is something more promoting with the social media and electronic media. Children can be benefit greatly from care provided by other adult, presence of sensitivity and a responsive caregiver. Uh, it's important to take care of yourself as a caregiver before you giving caregiver on children life. If you more focus your health, you would help children at the same time. Self-caring is very important during this pandemic period outbreak. um, Even some children, they don't live with the parents, they are living with the foster parents or caregivers or group homes. Still, the those settings can establish certain caregiving, healthy caregiver providing system. um, because the traumatic events are variable, it occurring again and again, and the traumatic events are more richful with new things day by day. And caring adults sometimes dealing with the traumatic event at the same time with children, they might forget to concern about children because they are dealing with so much their own trauma. And support systems are there, virtual support systems, online systems, suicide line, helplines. There are many service providing systems you can find locally, nationally, and I know some healthlines are now working in between Canada and US, so they're sharing their experience and services even between US and Canada. Um, so efficacy self-efficacy become a very important thing. It is the sense of human having control during the time of fear, anxiety, and uncertainty. Um, Children struggle with self-efficacy. Helping children to establish and increase their self-efficacy is very much important during the pandemic time. uh, the sense of having control and developing their own self-control system, self-managing system to establish self-efficacy, and especially important during the uncertainty and anxiety period, and identifying and helping, uh, not always staying with the level of parent child, and also going beyond an upper level professionals and mentorships professionals and service providers. It's very much important to build up that network connection. There are so many taboos, even though we all living in one of the very open-minded country. I still see the taboos and misbehaviors, myths are all over the places. So it's everywhere. For example, children can help following safety guidelines by practicing with them. You don't have to know drama therapy or any therapeutic practices to build up it, to promote proper hand washings, mask usings, and other steps. So that build up sometimes self-efficacy. Um, Emotional well-being affected the well-being to other parents and other caregivers. Emotional well-being is very important. We talked the first part of our discussion a little bit about the emotional well-being, creating opportunities and chances to the caregivers and parents to take care of themselves. And there are many resources you can see, my pamphlet and the materials that I provided to you before these lecturers, and whoever lecture, whoever listening to me, you could check the YouTube line, the information part of the discussion and YouTube line, so you could find more information and resource details. We talks about the professional help in children, show signs and helping children to manage and notify with the professional support, and how the trauma behaviors and signs, the trauma experience. If they're experiencing trauma, recalling, you could always direct them. There are many resource services running by provincial health, federal health, and other agencies. And establishing a secure physical and emotional environment is very important. There are a 3A's system introduced by Center for Disease Control, United States. So you could see those information in my pamphlet and booklet. So it's important to try managing those and learning about those 3R emotional, environmental approaches. And also, children tend to be really um, children tend to be really confused if they don't get the information right way. Most of the time, children getting the information that we are getting from social media, newspapers. They're so curious about this information that's specially provided and developed to children according to their mindful state, their intellectual, perceptional, cognitional level of understanding. Sometimes children try to digest the information that provided to adult. They might get misunderstand. They might experience confusion. So it's important children to provide and children opening to age appropriate information. So there are few uh, notify irritable sensible behaviors that you can identify with your children, and there are some steps that you can take to help children cope. Like for example, if you find your child is struggling with more painful, irritable, aggressive behaviors, so you need to help child to establish coping skills with patience, tolerance, and things like that. There are many simple techniques that you can use with play, arts, and very powerful approaches that you don't have to become therapists to try these. It's everywhere, and you can find many resources in online and public libraries. Um, like for example, if you find children having withdrawal from peers and lost interest with the social relationships, so it's important really to getting to understand what behind it and what withdrawals having, and helping them to discuss current situations, what they are feeling about the community and family, and encourage them to bring their question out, including what being done to family and community, and always helping them to understand it's happening now, even though they don't see it around them, they isolate and living in home, so it's happening everywhere, it's everywhere, and nothing to be worried about. So it's important children to have that messages that coming from adult. So um, like I said, you will find plenty of reading materials with the lecture, and even bottom of the below uh, the question line, you could find many resources. Finishing our 2 hour, ending our 2 hour lecture, almost. Again, it's time to let away, let process the taboos and myth and unbelievable misconceptions, however you name it. I'm sure you have plenty of name, because we all need to strengthen and develop a very strong loving and kindness, uh, empathic alliances in between all of us, like a network. Hope and pray and offering my loving and kindness, the pandemic must be go away, process away, and the 2021 would be a good year for all of us with many hopes. And I'm wishing you loving and kindness, metta, and I will meet you with from the next episode, our second lecture. It's about how the mental state, psychological state with children can be developed with